When we say understand the mode of transmission, it means that we just don't know it in our head, but we also behave in ways that will prevent us from getting infected. Going back a little bit to the history of where SARS-CoV-2 came from, what's happening is we're destroying our environment. We destroy our forests, and therefore, the animals and the insects come closer to human beings. I would like to introduce the concept of the epidemiologic triad. In the Philippine context, we have the host, and the host could be poorly nourished. The environment is where the Philippines has a double whammy because we have crowded living conditions. Even if you do everything you need to do about this, but you still have this kind of an environment and you have poor immune systems of the host, it's very difficult to control an infection. So what do we need to do? For the agent, vaccine, of course, is the most important one. Actually, herd immunity only occurs after decades of routine vaccination, meaning you have to have a program in place to continuously vaccinate people because people move around. Risk communication is one of the most important control measures of a pandemic. And when we understand the mode of transmission, prevention is possible, risk communication is the key. We were handicapped from the start because of decades of neglect of the public health system. We don't have electronic medical records. So right now, contact tracing is still a mess. If we do not invest in public health and social determinants of health, COVID-19 will become a chronic and lingering disease of the poor. We need more genome centers all over the country. The full implementation of universal healthcare is the only solution to COVID-19. Can we control? Yes. But we need to change the system. If people know that they're positive, then they'll avoid transmission. No? We need a 6-year vaccination program, not just let's vaccinate everybody right now and that's the end. I'm telling you, that's not going to work. Our audience are frontliners, doctors, nurses all over. You have to conserve your energy kasi mahaba pa to eh. We joined this profession knowing that there will be sacrifices that we have to make when an emergency like this happens. And you have all shown your ability to sacrifice, to serve, and to do your best for other people.